welcome. We are Lira University faculty from Department of Nursing and Midwifery, Faculty of Health Sciences. We are running a scenario simulation session.
You're most welcome to the simulation lab. This is a safe environment for learning. You have to feel free, don't be afraid. So in this environment of learning, whatever is discussed here shall remain here. It will be confidential, it shall not be discussed outside. So in this learning environment, it is a non-judgmental learning session. So you will treat whatever is here in a real-time situation, and you treat it as a real patient in real-time situation. Then here we have our confederate. She's Margaret, who is going to act as the mother. She's wearing Mama Natalie or the pronto pants, and this Mama Natalie, you must treat it as a real mother. So Mama Natalie has several functions in it. Mama Natalie has a uterus that is able to contract and able to relax. Mama Natalie also has a urethral orifice where you can insert a catheter if you need to drain the urine. Mama Natalie has also a birth canal where the baby passes through. Mama Natalie also is able to bleed. It has a bleeding tank where it uses the artificial blood, where it's always mixed and filled in. And it has a control tank, which is being controlled by the moderator, who is wearing the pronto pant. There's a tank where she will open for it to bleed, and there's also a provision for it to bleed excessively and for it to stop bleeding. So in this environment, we also have our equipments for use, for managing our mother. Here we have several equipments that you need to use in the management. We have our well-set trolley. So in this trolley, it has a drip stand where if you need to put up a drip, you can hang it and use a giving set to resuscitate the mother. We have the disposable gloves that we need to use. We have the surgical gloves for the procedure, and we have the pads for padding the mother when the mother is now comfortable and safe. We have the vital machines. We have a blood pressure machine for taking the vitals, and we need to do it in real time. We need to take the blood pressure for the mother, not for Mama Natalie, because the mother who is acting is a human being. So we need to take the blood pressure in real time, and there will be someone, the facilitator, will be giving the findings, the real values for the blood pressure, but you take it in real time. We have the oxypulsometer, where you also need to really take the oxypulsometer for the mother, and the findings, the values will be given to you. We have the misoprostol tablets for management of the mother. We have the KY jelly, which will be used during catheterization. We have the cannulas in different gauges and different colors. Large ball cannulas for saving the life of the mother. We have the vertutainous red and purple for taking the mother's blood to the laboratory for quick investigation. We have the strapping if we put up a cannula and we need to strap it. We have the oxytocin, which is given to the mother on the left thigh for control of bleeding. We have syringes to be used if you need to give drugs. We have our gum boots We have our gumboots, we have the aprons, we have everything around. We have the placenta at the bedside, which needs to be examined to be sure that our mother is safe.
Thank you, Barbara. And in case you need to use the drugs, please do not break. Just demonstrate that you are drawing, but do not break our ampules. And do not prick the mother, okay? Do not prick the mother, just place. But for fluids, you can actually connect and run. You connect it to our urinary bag. And whatever happens here, you need to maintain confidentiality. Whatever happens in here, please do not say it out. And then be in your profession. Play your role as a professional. The roles that you have to play to manage this matter, play it within your profession.
Thank you, Christine. Do you have any other questions? Okay.
I'm seeing something here which we didn't talk about.
Okay, thank you for the reminder. This is what we called a balloon tamponage. It is one of the, it is used in the management of primary postpartum hemorrhage due to uterine atony. That it's inserted into the uterus to make a balloon into the uterus and to squeeze the blood vessels to act as the living ligatures to control the bleeding.
Then you also talked of we can run fluids. Won't they wet the environment?
So if you are running the fluid, we shall connect a urinary bag where the fluid will be collected into so that our environment is not soiled. Thank you so much. Another question?
In case you don't have any question, I would like to invite you close to feel the uterus when it's contracted or when it's not contracted. Please feel and tell us what you feel.
Contracted. Uterus feels soft.
So in case there are no questions, we request you to move out briefly and then just for a few seconds, organize yourself and come back.